Good afternoon, everyone. It's wonderful to be in Odisha. I like this state very much. I come from almost your neighborhood, Assam, though I have been living in Delhi for the last 2 decades. But my childhood was all about Odisha in the sense that my favorite novel, which I read in Assamese probably 100 times, was based in Odisha. And I like Odisha food, and one of my best friends, he's from Odisha, Neela Madhav Panda, you probably know him. He has won many laurels from the state. So great to be here, and we are discussing something which is even wonderful, the healthcare facilities in Odisha, and especially this Biju Sastha Kalyan Yojana, which has probably revolutionized the healthcare, especially for the marginalized class, for the economically backward class. And we have with us the man who is actually driving this whole initiative, though a brainchild of Chief Minister Naveen Patnaik. So Dr. Mohapatra, when we talk about this BSKY, the first question that comes to my mind is that we already have Ayushman Bharat in the country. So why do we need a separate insurance scheme? So when I first read about it, is it in competition to Ayushman Bharat? Is it complementing, or it's something totally different?
As you know, our Honorable CM believes in every life is precious. So now at present, Odisha is standing tall in the healthcare, like in provision of universal health coverage. So to march towards universal health coverage, our Honorable CM wants that most of the population should be covered under the health assurance scheme. So in almost all the other assurance schemes, they have taken socio-economic caste census 2011 as the to enroll the beneficiaries. And we have taken this National Food Security Act beneficiaries and State Food Security Scheme as the beneficiaries of National Food Security Act and Food Security Scheme are the beneficiaries of Biju Sastha Kalyan Yojana. So now we are covering around 80% of population under Biju Sastha Kalyan Yojana. If we would have taken socio-economic caste census, we would have covered only 60 lakh population. So to march towards universal health coverage, definitely government wanted to cover most of the population. And number two, state government has always given emphasis on women empowerment. And traditionally, there is a perception that because in the community, as a result, what happens, the female health gets less priority. So that's why under Biju Swasthya Kalyan Yojana, this provision is 10 lakh per annum per female. Suppose 5 lakh is there per annum per one family, and after initial exhaustion of 5 lakhs, then after another 5 lakh is there for the female member of the family. So these are the basic differences between other assurance schemes for which this implementation of Biju Swasthya Kalyan Yojana is there in the state of Odisha.
But there are certain other facilities also, while we were discussing earlier today, that you said that this is applicable only for critical care when it comes to private hospitals, right? And in government hospital, it's absolutely free, right? Now the question is that while you make it absolutely free for everyone, irrespective of a economic bar, don't you think it can also be seen as a waste of public resources? Like someone who can afford the healthcare facilities in a private hospital or anywhere else, he or she also may go to the government hospital just to have this free healthcare, which, as you said, is also happening. People are coming from neighborhood states.
Yes. So because BSKY has two components. One is total cashless treatment in all the government health facilities. That is the component one. So that is cashless irrespective of this residence and income. So anybody going to a government facility gets cashless service. So he or she may not be a resident of Odisha also. So anybody coming to state of Odisha, and if he or she has a health problem and goes to a government facility, he or she gets the free cashless medical care or health care. But what happens for critical, actually we have 2071 packages, and mostly the tertiary care, we want that the people should go to the private health facility for the tertiary care, and other primary and secondary should go to the our government health facilities, because all the government health facilities are not in a position to cater to the tertiary care problems of the community. So that's why government is leveraging on both private hospitals and government hospitals, the strength of private hospitals and government hospitals. So definitely now, because already 5 years have elapsed, and so now we are also analyzing, and according to emerging situations, we are also modifying our guidelines, because now earlier only the beneficiaries of National Food Security Act and State Food Security were the beneficiaries. Now government has expanded it to also the left out population of the rural areas. So now government has introduced BSKY Naveen card. So the population in the rural areas who are not government employees, or in the family if there is no government employee is there, and no pension holders, no income tax paying, and they are not beneficiaries of existing BSKY. So now they are also going to be beneficiaries of BSKY Naveen card. And in phases, government has assured that also other population of the urban areas, government employees will be included. Because as you know, the catastrophic expenditure for health pushes most of the people to poverty or below poverty line. So at least government wants that nobody should be deprived of this quality care due to want of money. So that's why also we are investing in government health facilities. Like recently under 5T initiative, we have government has launched a program, Amma Hospital. So what happens, there is a robust feedback mechanism that is called Mo Sarkar. So the feedback are taken from the beneficiaries, from the patients, and depending on the feedbacks, government wants to fill up the gaps. So under this Amma Hospital scheme, all the 1858 government hospitals have been taken up, and already budget allocation has been made. That within 5 years, this 1858 hospitals will be refurbished. This refurbishment of the infrastructure, strengthening of the patient service delivery, strengthening of the basic patient amenities, and this quality certification of the health facilities. And so what happens now? Both these sectors are taken care of by the government. Private hospitals are also in the loop to provide quality health care. Simultaneously, whatever gap is there in the government health system, that is also being worked out, and the gaps are filled up.
You mentioned a very valid point that this expenses on healthcare, it actually at times it drives people to poverty. Have you, in last 5 years, have you seen any trend emerging which is showing that productivity of the people in Odisha, it's growing, or it's having any impact on the economy in poverty reduction? Have you noticed certain trends? Any numbers?
No studies have not been done, but I think it has impacted a lot on the quality of life, and because people directly walk into the big hospitals and get quality care, and definitely if studies are conducted, it will definitely show that it has happened. So till now, study has not been taken up.
Dr. Samantasinghar and Mr. Anand, this is a question to both of you. This scheme is in a way revolutionary in Odisha, and you both run private hospitals. Yours is also a college, medical college. So what are the trends you have seen after the launch of this scheme in patients reaching your hospital and the way they are benefiting? Because it's always said that private healthcare is in India is beyond reach of the common people. So I'll first ask Mr. Samantasinghar, Dr. Samantasinghar. So what are the trends you have seen in last 5 years in terms of giving healthcare from a private player?
My namaskar to everybody. Actually, BSKY started 2.5 years back. Before that, it was RSBY. And what you told that the private healthcare system is for the rich and the privileged doesn't hold good for Odisha. I have seen hundreds and thousands of cases where the poor people have walked into the private hospitals, to my hospital, I'm telling you, to IMS and some hospital with that card and claiming that they are a beneficiary and they have got the treatment and walked back. And here another thing, the confidence that the common man gets. Because healthcare is not it's a costly affair. Healthcare is a costly affair, no doubt about it. But the confidence that the poor man has got, or not poor man, general common man, the common man has got because of that card is immense. That changes the character, attitude, everything. I can say, because I'm seeing that every day, I'm interacting with them every day. Now they can walk in confidently, show their card, get the treatment, go back home. I've seen cases who have not gone to the hospital for 20 years. But now, after 20 years, they can walk to the hospital, get the same treatment for that disease that they are bearing with for 20 years, 30 years, like that, 40 years. Now they are getting it treated and going back home. It is a great feeling, As a doctor, I am feeling very proud that I am associated with, I am part of this history, you can say, or this revolution of this accessibility to healthcare. Accessible, because there is no, they don't have to, because it is free, cashless. So it is not that they are worried about paying. They can walk in. That confidence is I think it affects the personality, character of the common man. It's a huge change. Not only in healthcare, in general, it's a huge change in the attitude of a common man.
It's the same with Mr. Anand. You in your hospital also?
Yeah, I agree with Mr. Samantre. This scheme, the BSKY scheme, I would say, has gone to, every corner of Odisha, wherein people, they were not able to think to get the treatment done because of the financial burdens. This BSKY scheme, what I have seen it, I correctly, I would like to definitely agree with him. The people walk in with the cashless card. They, get in biometrics done within seconds and get admitted to the hospital, which is something, the game changer, I would say. Like, I haven't seen, I have worked in different parts of the country, but I haven't seen this kind of facility in any parts of India, wherein this is so seamless, so smooth, wherein you come in and get the, admission done and get the treatment to the best of the doctor, best of the facility, best of the techniques which, we follow in, every part of country. Same thing you can get it. And this common man is getting it, that facility at, without paying penny. That is the, beauty of this, BSKY card.
Now the government has done its part. They are giving the poor patients the power to pay for their bills. What the private sector players are doing to reduce the amount of the bill. I'm not saying you have to do charity, but the earlier allegation that private players do charge a lot. Of course, you would tell me that the tariffs are almost the similar everywhere. There has been a benchmark, but still, it's much higher than what a common person can afford without the government support. So again, I'll start with Mr. Anand. What is your hospital doing, or in future plan to do to reduce the healthcare for a common person?
I would say, instead of affordability, I would say the value. For me, the value is to go to the Maruti Alto. For the same thing for other person, I would say they would like to go to the BMW. So the point what I would like to make in here is, like, for me, I would like to walk into the hospital and get out from the, hospital within a, in hour, in fact, Similarly, for the other person, going to the government hospital, that, you spend in a day, in fact. So, I would say, I think so, the answer for this affordability is to cover the entire public and cover the entire public in the insurance. So if all the public are covered in the insurance, they have an opportunity. Like, example, the BSKY, they have, the certain ward, like, you would like to avail to the general ward. If somebody would like to know, I would like to avail, single ward, deluxe ward. So they have the insurance card and they get the treatment done, in fact. So, I would like to thank Mr. Bishnu that, he has mentioned that, the 90% of public is having the BSKY card. So, almost every person is having a BSKY card, but I'm sure there are people who are having insurances card. So they have an option either to go in the BSKY, either to go in insurance. So it depends on the person to person, and the affordability, this is the answer I would say that, covering the entire public into the insurance scheme.
Dr. Samantasinghar, what you are doing to help the poor from your side, means how are you reducing that cost of healthcare? Quality, it's fine. Mr. Anand mentioned about BMW and Alto. But here probably we are talking about more of Alto customers, not BMW variety, because they can go anywhere.
Actually, I am lucky to be working in a medical college. It is a 1750 bedded hospital. It's huge, massive. As of today, we have got more than 1400 patients. And out of that, 1200 patients are BSKY patients. So now tell me, maybe 2 years, if you go back, 3 years back, 4 years back, no hospital, I am answering to your question only. 4 years back, do you think that all the hospitals were having full capacity? No hospital had full capacity or all the beds were full. It was never like that. But BSKY has helped the hospitals also to keep their beds full. That itself brings in affordability. The more number of cases that we are doing, suppose we are now doing major surgeries, 100 major surgeries. So the price of surgery in the OT, the cost of OT will come down because of the sheer number. The number increases, the price will come down. So that is what I believe is helping our hospital also, all hospitals, to cater to this huge load of BSKY patients. Suppose in BSKY, in the critical care, in the ICU, the package is like 13,500, exclusive of major investigations and drugs, 13,500. So how the hospitals are managing? All hospitals are managing in Odisha, even outside Odisha. How they are doing it? Because of the sheer numbers. The numbers are helping for the hospitals to increase their efficiency. Different methods are being brought out. The duration of hospitalization is reduced. The earlier the patient leaves the hospital, once he is fit to be relieved, then immediately the patient has to be discharged. No need of keeping the patient more than after surgery, maybe a fifth day. We are doing this all automatic knee replacement robotic surgery. We have started it 2-3 months back. We are the only institute in this part of the country to do fully automatic inside the BSKY package. So in those cases, the recovery is extremely fast. I am giving you one example. So on the second day, third day, the patient starts walking with the help of the crutch. So maybe by fourth day, the patient is discharged. Now think of a knee replacement surgery patient getting discharged on the third or fourth day after surgery. It is like a dream come true. It doesn't happen everywhere. This is what the magic of maybe the medical science and BSKY has come together to produce this magic. We can put it that way. So maybe that is helping large number of patients. Use of technology, less period of hospitalization is bringing in affordability, or the hospitals can get adjusted to that package. And ultimately, large numbers is good makes good economic sense.
So economy of scale is working here. Dr. Mohapatra, now 90% of the population is covered by BSKY. So what would be the annual outlay for this whole scheme? And how sustainable this is? Every year can a state like Odisha, though it's progressing very fast, but it's still not at the top in terms of resources. So how sustainable it is for, say, next 5, 10, 15 years?
So now it is 80%, it is going to be 90%. So thing is now, for the year 24, 25, it is the outlay is 5,450 crores. And the total budget of health department is around 90,959 or around 20,000 crores. And every year, the allocation in health sector is increasing. So it is around 24% higher than the last year. So government is as also already told. So this percentage of health allocation is more in Odisha state of Odisha. So because government of Odisha gives emphasis on health, definitely the budget allocation is increasing, and government is trying to make it sustainable in the next years by strengthening the government health system, so that people definitely, most of the diseases like tertiary care also can be taken up by the government health facility. That's why during last 4 years, around 4,000 doctors have been recruited. Now, 8 new colleges have been established to produce more doctors. PG seats are increasing to get more specialists. As I told you, under Amma Hospital scheme, so there is transformation of the hospitals with also quality improvement. So that's why when the government system will strengthen, automatically people will go to government health system and it will be sustainable. Although we will take the help of private players, but the dependency will go down and will be more self-reliant on the government health system, and definitely that will be sustainable ultimately.
Though Odisha is spending almost double the amount when it comes to per capita, per individual expenditure on every human being by the state government, if we compare it with the national average. But certain parameters, Odisha traditionally, not that it's a problem of now, on say IMR, MMR, institutional birth, or bed per patient and all that, these were relatively lower than the national average earlier. After the launch of this scheme and the previous version of this scheme, have you seen changes in these parameters in last 5 years, say for instance?
So definitely at present, the state of Odisha is standing tall as an achiever state in the healthcare system, healthcare field. This IMR this highest point of decline has happened in IMR, and second highest decline in maternal mortality ratio, and complete immunization is around 90% now. And so all the parameters, like we are second in TB reduction in total India. So all the parameters have improved within the last 5 to 10 years. So definitely, all the schemes of government of Odisha has impacted to reduce the disease burden, mortality, and also the improve the parameters, as you told about IMR, MMR, your immunization, TB, and also this institutional delivery. Now it is around 92%. So definitely it has improved.
Thank you. I had many more questions to ask, but the clock is ticking. For me, it was a very enlightening discussion. I hope you all enjoyed it. You learned something new. Thank you, Dr. Samantasinghar, Mr. Anand, and Dr. Mohapatra for being part of India Today Conclave. Thank you so much. It was an honor having you all here.